Hello, welcome to episode 3 of our K-Laser. Today we're going to go over an actual treatment of the K-Laser on Dr. Christina and tell you a few more facts about the laser while we're doing the treatment.
So with Dr. Bailey, we're going to use the laser and we're going to do my wrist today.
Alright, so we're just going to walk you through kind of how we set up the K-Laser. So as you can see, we have our first screen, just simply going to hit new treatment. From here, we see our body. You can choose what part of the body we're going to work on. Like we said earlier, we're going to do Dr. Christina's wrist today. So, upper extremity is our next choice. Here you see all the things: shoulder, arm, elbow, forearm, wrist, hand. Like I said, it's the wrist. You hit the wrist. There's 4 different settings in the wrist one. Each body part has multiple settings. For here we have general, trauma, edema, carpal tunnel. We're just going to do general today. It kind of covers all your bases. It's kind of your safe bet if you're not really sure what's going on. So we go with general, then we choose our body size. Again, we have large, small, average, or a child. We're just going to go with average, and then we go to acute and chronic, which we touched on last week. Acute is your very recent injuries. You know what happened right away. Like you heard it, ow, it hurts. Your chronic are going to be things that occur over time. They build on and on and on. It never really goes away, and it just keeps getting worse. So today we're doing our chronic. Then we come to our pain level. This we typically just ask the patient, hey, what's your pain today? It's on that scale of 0 to 10. Again, 10 being the worst pain, 1 being very, very little pain, not too bad. So what's your pain today?
We'll do a 4, since I
Right.
use my wrist a lot.
Next comes our skin tone. Again, we just look at the patient, you kind of match it up. All right, she looks like she's about a type 2 today. Again, the darker the skin tone, the more energy we can put into it. All right, and as you can see, it's a 2-minute treatment. It brings everything up for us. I don't have to do a whole lot of math or numbers in my head, which is great. So we got our glasses on, we're ready for the treatment. All right, so all we simply do, hit start treatment. We choose our laser head, which we've already determined, and we simply just place it on there, and it starts going.
All right. With this laser, you actually have to keep it moving continuously, otherwise it can burn you because of how strong it is. With a lower level laser, you can keep it in place because it only really goes through the skin. This goes through skin, fat, muscle, tendon, bone, so it has much more potency. We were talking about last time the strength levels of it. This has 4. It has a 650 nanometer, which means it's a super, super small measurement in length, and that goes through the skin. Then you have an 810 nanometer, which is for ATP. So basically what that means is when ATP increases, energy increases. Now at the 915 nanometers, that's more for hemoglobin, blood, and then oxygen, so more nutrients go to the cell to help accelerate healing. Then at 980 nanometers, that's when water comes into play, and that's what comes in so it can carry the waste away that it's breaking up here, so it can accelerate the healing and get all the bad away. This is only a 2-minute treatment, so it's really quick. A lot of times with the laser, you will do a 2-part treatment because most wrist injuries involve the elbow. Elbow injuries can involve the shoulder. Shoulder can involve the neck. So a lot of times you do 2 parts. But with the moving, you can push in some areas to push the nutrients. You can do lines like Bailey's doing, or you can do circular motions to kind of break up the area. And if you do have an acute injury, you can also KT tape it afterwards to keep it in place if you sprained it or moved it. And the treatment's over. That's how quick and easy it is. All right, so a little bit about how the laser felt when it was on my wrist. Basically in the beginning you feel some heat. On a level 4, which is what I did, it's not going to be as high of heat as a level 10, but all it does is feel like some warmth coming in, and with the constant movement it actually feels really good. It loosens up the region, and then for about 24 to 48 hours after, sometimes you can feel a little bit of heat there, so you do not ice after these treatments because it is called vasodilation. It's opening up the blood vessels. If you put ice on it, it constricts it and closes them. But it feels really good. Most everyone who's had it done on their neck and other body parts said it feels amazing.
So, what we want you to do, after watching this video, we are still trying to give away a laser treatment for people who comment on our posts saying what you want to see next, maybe what else you want to learn about the K-Laser. Also, if you comment by tagging a friend who you think would benefit from the K-Laser, can also enter you in, or sharing our post. So keep sharing, commenting, and liking this post.
And we want to announce our winner from last week for the treatment of the K-Laser, and that would be Mike Burrington. Thanks so much. You can also call in any people you refer into the office that call in and schedule treatments, enters you in as well. Thank you so much for all your referrals. Next week we will be talking about...
We will talk about how chiropractic and the K-Laser work hand in hand.
Have a great day, and this is Dr. Christina and Dr. Bailey signing off.
See ya.
Bye.